Well, if the rising costs of gas and groceries wasn't enough, your health insurance premiums could also increase. News Channel 34's Amal Taliji has more on what factors into driving up those premium costs.
Health insurance premiums are linked to many different variables. Reasons for the increase in cost are due to ongoing effects of the pandemic, health insurance taxes, drug manufacturers, and underlying healthcare cost. Eric Linzer, president and CEO of the New York Health Plan Association, says health insurance rates have already increased the past 2 pandemic years. With only necessary appointments recommended due to the pandemic, patient care that was needed was pushed back to a later time.
And that care came back in some instances more complex and they're more costly. Those costs get factored in. There were increases the last couple of years, but in some instances, it didn't always reflect the full cost of services and the cost of care for the current year.
Linzer says decisions the state legislature make can also contribute to higher premium cost. He's referring to legislation that prohibits any kind of change in health plan formularies, also known as a list of prescription drugs covered by a drug plan. There is also a law that prohibits certain copay accumulators from going towards deductibles. Legislation to repeal this bill has passed both the Senate and the Assembly, but has not yet been signed by the governor.
If we're going to get those costs under control and make premiums more affordable for individuals and employers, it's really important that policymakers look at what the underlying costs are. 82% or more of the premium dollar goes to pay for doctor's visits, hospital stays, prescription drug costs.
Proposed legislation, Linzer mentioned, would require drug manufacturers who are planning a price increase of more than 10% provide an early warning to the state.
This would allow health plans, employers, providers, and the state to factor in and prepare for those increases. That would go a long way to at least providing some level of accountability for big pharma and the prices that they charge.
Health plans filed their proposed rate increases back in May. The state's Department of Financial Services is reviewing those requests. They'll come up with their final decision by early August. Reporting at the Capitol, Amal Taliji.